Hi, too loud. Okay, so first of all, I want to say thanks to Danish Saab and Khalid Saab for this is a wonderful opportunity. Open and APPNA collaboration is a wonderful thing. And just to tell you, I'm an entrepreneur. I'm not here only for investment. I'm not only for here selling something, but I'm here for collaboration between physicians and innovators. If you bridge that gap, we'll be having more innovations and our country needs more innovations. So let me start with the Opthalytics. Opthalytics is a early disease detection technology. It's based on artificial intelligence. So just to take a look at how we can revolutionize healthcare using this technology. We have built that platform on deep learning, convolutional neural networks and generative AI, and where we can apply this is huge, like the huge potential. We can apply this technology to ophthalmology. I'm going to talk about ophthalmology all today. We can do it for cancer detection, radiology, you name it. So we started with ophthalmology. Okay, let me do one thing. I'm tall, so I can just keep it here, right? So why we started with ophthalmology? Is it okay now? Yes. Okay, thank you. Number one thing in our radar was eyes is the gateway to the whole body. So we can see if we leverage eyes we build a technology for eyes, it can. Second thing is, in America, diabetic retinopathy is a public health problem. It's unsolved problem as of today. Third, we have validated our technology, and I'm going to share some amazing stories today where we solved this. And number four, I have actually this device in my hand. This is our partner that is one of the largest camera manufacturers in America, in the world actually, in Europe also. So they evaluated 22 technologies and they selected our company as their go-to market. Let's talk about problem a little bit. 37 million Americans live with diabetes. 96 million are pre-diabetes. In America, there are only 3,000 competent retina specialists for this early detection of these diseases or whatever they want to do. Unfortunately, every year, because of the lack of eye exams in primary care, internal medicine, all over 2 million people have a partial vision loss, with 65,000 people going completely blind in America, the richest country in the world. Unfortunately, 95% of this disease was preventable by early detection. This is our solution. We have built an artificial intelligence-based technology to detect diabetic retinopathy within 10 seconds. And I'm here for quick demos. Anyone want to do that today? Okay. So beauty of this technology is that it can collaborate, it can integrate with around 22 camera companies we have partnerships with. And it is also working on the wide field imaging. That is going to be a breakthrough technology in America and in Europe. And I'm going to talk about our partners also. But before that, I just want to talk about earliest validation. We started with our own homeland, Pakistan. We implemented this technology in 2021. Alhamdulillah, as of today, early January, we completed 120,000 eye exams with the multiple hospitals. 56 people were prevented from going blind in Pakistan. They got anti-VEGF injection and got early detected by our technology. We have multiple validations. Alhamdulillah, we are also working with Aga Khan Medical College. There are a couple of months left until we get the results. Early results are amazing. Anyone can reach out to Dr. Haroon Tayyab. We are blessed that he said we can be your reference before even the study is published. Once this study published, I think we will be one of the unique innovators in diabetic retinopathy space around the world. I'll just hold on to that. I'm not going to share anything. We have multiple partners in America. We are working with a few of the largest organizations. We got invested with AWS. They invested $220,000 in our company. We are partnered with NVIDIA. A lot of people know about NVIDIA chips. Creative Destruction Lab, we are the graduate company, Seattle last year. ATDC, and also we are working with Wellstar, Optos, you name it. Optos is the company that is the wide field manufacturer that I said for the camera. So we are the only AI that is working on the wide field imaging. Only diabetic retinopathy is around $2 billion market in the US. We have committed revenue of around 1.6 million with 3-year commitment, and we are implementing starting this quarter. We have 4 patents on artificial intelligence based technology. Number 1, how we generalize our technology. This is one of the issues with AI, that it don't generalize easily, so we have patent on that. Actually, we are patent pending, by the way. I'm talking about my vision now. So diabetic retinopathy is just a tip of the iceberg. We can take this technology. Our next disease is, by the way, cardiovascular risk assessment. We are applying for the breakthrough status with FDA. And also we are applying that to multiple other disease conditions. Also, we can do AI-based drug testing. Within a minute, we can detect using the retina. Also, one of the biggest thing is we are generating our own foundational model. People who know about ChatGPT, LLMs, so we are building our own foundational model on that. And dermatology was our previous disease when we started that. Just talking about my team, Alhamdulillah, we are blessed that we are one of the strongest team in this domain. Dr. Neelam, Fatma Jana medical graduate. Can you, Neelam, please stand up just to raise your hand? She's my co-founder in this. She's a lifetime APPNA member and my boss, because she's my wife. Anyway, sorry. So we have Cleveland Clinic joined us in this initiative. We are blessed that Peter Kaiser, who's the chief retina specialist in Cleveland Clinic, 40 years in this industry. And we have multiple other names. Abu Bakr, who is the open president. We are blessed that he sponsored me in this New York event 3 weeks ago. Alhamdulillah, I stood first, just presenting. We have multiple other people, FDA consultant who is working with us for the last 20 years. So this is our brand actually. We're not only eye diagnostics company, we are a 360 intelligent diagnostics. We will be adding cancer diagnostics and dermatology as our future. But last, we are raising $1 million. All the money we have spent so far and where we are, this is our own money. Just like bootstrap for like 150,000. We assume in 2028, as of today, we are raising at $9 million. We assume at 100 million valuation. And I'm open for any questions.
We have time for 2 questions.
Thank you for the presentation. It was fantastic. So I have a question. We have kind of a great opportunity to work with several ophthalmologists in our practice. And one of the things that I've noticed is they're so proud of their equipment. They've just spent an arm and a leg on an OCT or OCTA, and they love showing it off. What is the prospect of using your technology as a software to implement those existing devices, where the ophthalmologists don't have to go out and buy a new machine and think that these other things that I've just spent so much money on have been rendered not as useful as some of this other machinery? Is there a prospect for that in your model?
Well, first of all, great question. Second is that one of the beautiful thing about, and that is one of our patent, how we generalize between all cameras. We can work with any ophthalmologist. There is a ophthalmologist in Pakistan, in Lahore. His name is Dr. Suhail Sarwar. He's our early implementer. He's using our technology in his office. Second thing I just want to highlight, some people confuse that. This is not for ophthalmologists. The biggest impact this has at the internal medicine and primary care centers. We are bringing human plus AI to go to market. That is another thing. We have an AI and we have human. They just sign the report just to bypass FDA, and that is the go-to-market product as of now in the market. If there is any internal medicine practice or primary care, they can reach out to us. We are offering 3 months only for APPNA members. Initial discount, okay? Free of charge. You can evaluate the technology and then you can take it. Thank you. Thank you for asking this question because it gave me an opportunity to introduce ourselves.
That brings me to my question. What is the cost of the handheld device?
Sorry?
what is the cost of the handheld
Okay,
device?
again, great question. Because I want to share one more knowledge of that. I have this device approved for Pakistan. We have a distributor in Pakistan. First time in the history of Pakistan, artificial intelligence-based eye exam device is approved. In the US, its cost is around 6 to 8,000. If you work with us, it's like, of course, because we are the primary partner of them. In Pakistan, its price is even less. Latif brother in Pakistan is a distributor of this technology. We are working with, by the way, multiple centers in Pakistan. We're working in Karachi. Hashmani Group is working with us in multiple implementations, so we are actually bringing that to Pakistan. But here, I think I answered the price, right?
Thank you so much.
Thank you so much.